Hey folks, Dr. Olson here with Sports Medicine Orthopedic Centers. I'm an orthopedic surgeon and I'd like to continue my discussion on shockwave therapy. This has become a staple in our practice because we've seen a lot of success with it. We have a lot of happy patients that have undergone shockwave therapy for a variety of conditions and are very pleased. So the next topic I'd like to talk about is the risk and the cost. So first off, cost. Shockwave therapy is traditionally not covered by insurance. There are some exceptions to the rule. When it's used for wound care, but most instances it is not. The cost is very manageable. Typically takes anywhere from 4 to 6 sessions, and it certainly is a lot less expensive than the cost associated with surgery. Not the surgery itself, but also the cost associated with downtime, having to be immobilized for a long period of time. Our patients have very active lifestyles, and one of the best advantages of shockwave is that there is no downtime. The treatment takes 5 minutes and there's typically no lingering discomfort and patients can be on their way. The treatment's usually done once a week. So the cost, on a proportionate basis compared to, let's say, surgery is a lot less expensive, and I think just about anyone would prefer to avoid surgery if possible. So then risk, that's the next big question that I get. Is there risk associated with the procedure? Well, I think the short of the answer is the procedure is extremely safe. It started in the 1980s with lithotripsy, or breaking up kidney stones, and then found its way into orthopedics and bone and joint problems and muscle problems in the 1990s. So there is a ton of literature around shockwave. And so final answer is yes, in most cases it is extremely safe, and there is years of literature to support that. So there are some instances where shockwave therapy would be contraindicated or not indicated for certain types of patients and their associated problems. So a few of those things include individuals that are on blood thinners. Second would be individuals that are pregnant. We certainly don't want to be doing shockwave over a fetus or a developing baby. The next one would be individuals that are being treated for cancer or have a tumor. And we're talking about regenerative medicine. And so we're using a technology that the goal is to stimulate healing or tissue formation. So we certainly don't want to use this over an area that we're trying to prevent further growth, namely a tumor. And then last but not least, we avoid the use of shockwave therapy over the brain or over the spinal cord. I think those are two exceptions that we avoid. Other than that, in most cases, it's extremely safe and patients don't have any lingering discomfort, and there is no downtime. So there's a lot of benefits associated with it. It's something that is very safe. There are no incisions associated with it. And so our patients come in for a treatment and then they're out the door, a few minutes later. And we typically see them on a weekly basis, anywhere from, like I said, 4 to 6 treatments. So if you'd like a deeper dive into shockwave, if you have any further questions, feel free to jump over to our website at smocSC.com. And thanks again for joining me. Have a great day.